everyone. Myself Dr. Jyotsna Jain, and today I am going to speak about an international classification of functioning, disability, and health. So before I start my topic, I would want all of you to go through these two case vignettes about two ladies having recurrent depressive disorders. So we'll go quickly through their cases. Maya is a lady who has had her first depressive episode at a younger age. She was school dropout, never had a steady job, remained unmarried, and had a child with an unsteady romantic partner. Her child was reared by Maya's mother, and she found it overwhelming. So often they would have interpersonal relationship issues. And recently, she reported to her doctor a few weeks back with a depressive episode with very poor self care. The other lady, Jaya, had a similar history of multiple depressive episodes, but she had an advanced degree and a successful career. She was a university professor. She was married for 15 years, had two children, had a stable job, and although she also presented in her episode, she would report that would found herself lesser productive during the episodes. So, what would you diagnose these two ladies as recurrent depressive disorder, and what code would you give? F33.3 according to the ICD-10 diagnosis. Let us find out that how does ICF classifies these two ladies differently. So the overview of my presentation would be introduction, covering principles of ICF, the biopsychosocial model, the classificatory system in itself, the uses, its relevance to mental health disorders, and conclusion. So after the international classification of impairment, disability, and handicap, the ICF received its approval in May 2001. It is a classification which is of health and health related domains of functioning and disability. ICF is structured around three broad components: body function and structure, the activities and participation, and the third part is the additional information on environmental factors. So ICF describes the disability also under these three domains. So if impairment related to body function and structure, activity limitations, and participation restrictions. So for example, in a mental health condition like panic disorder, the impairment would be heightened levels of anxiety, the decreased social interactions could be the activity limitation, and poor social relationships due to the given disability is the participative restriction. So these are the four principles of the ICF. Universality is that this classificatory system is applicable to all people irrespective of their health condition. Parity, that it is not differentiated by the etiology, whether it is physical or mental. Neutrality, that one can express both positive and negative aspects of the functioning and the disability using this classificatory system. And additionally, it gives information about the environmental factors, both facilitators and barriers, like social attitudes, laws, etc. A very important contribution of this classificatory system is the biopsychosocial model. As we understand that the disability traditionally was understood as a medical model, under a medical model framework, where it was understood to be arising from a disease. So if the disease is removed, the effect of that is the disability can also be removed. The other extreme understanding of disability was a social model, where it was understood to be arising from the lack of because of the unaccommodating environment. So biopsychosocial model provides a combination of these two models, where the health condition causes impairment in body function and structure, causes activity limitation and participative restriction, and is affected by various environmental factors and contextual factors. So coming to the classificatory system in itself, it involves a alphanumerical form of coding. So for example, for body function, the code used is B, and for body structure, the code used is S, and the number which is after the decimal point indicates the severity of the impairment. So Similarly, for activity participation, there are various qualifiers like performance qualifier and the capacity qualifier. And for environmental factors, we can code both facilitators as well as barriers.